Good day. Our thesis is entitled Tooth Condition Classification for Dental Charting Using Convolutional Neural Network and Image Processing. I'm Marc Reyes, and my groupmate is Arryll, Mori, and Antolin. Our advisor is Engineer Dionis A. Padilla. Oral health is something that's often neglected by people, which causes teeth problems, such as dental caries, also known as tooth decay. The decay starts with the bacteria present in the mouth that turns the sugar and carbohydrates from the food a person eats to acid and demineralize the hard enamel of the tooth. Depending on the dental caries, restorative methods such as dental filling, or in worse cases, extraction may be applied. This is why the need for regular dental checkups is necessary to detect occurrence of tooth decay and to maintain oral health. Most tooth condition classifier tools are only focused on the dental caries detection. Existing multiple condition classifier utilizes the use of panoramic radiograph. So for the general objective, to be able to produce an accurate dental chart based on the data captured by the device. So for the specific objectives, to construct a device that can capture images of the front, upper, and lower images of the teeth inside the mouth. To implement image processing and convolutional neural network on detecting tooth condition. Lastly, to determine the accuracy, sensitivity, and specificity of the device using confusion matrix. The significance of the study is to be able to perform automated dental charting, serves as a foundation for a more complete automated dental charting in the future. This study focuses only on classifying teeth that are in good condition, surface dental caries, has indication for extraction, with fillings, and missing teeth. It does not include internal dental caries, which are only detected in X-ray scans, does not classify whether the tooth has jacket crown, pontic or bridge abutment, supernumerary tooth, and etc. Excludes the person who still have temporary tooth and have braces, or anything that fall under this orthodontic specialization.
The flowchart shows how the system works. The system will receive input images of patients' mouth sections. It will be transferred into a computer via wireless file transfer, specifically Secure Copy Protocol or SCP. Afterwards, the images will be processed by the trained CNN model for classification and result allocation through segmentation. Lastly, the yielded output will be an Excel file containing the dental chart of the patient. For the image classification and segmentation subprocess, images will be subjected to the tooth condition classification process. Then it will evaluate the image for the possible tooth components with their respective classification. Lastly, the priority list will be used to compare all the results to get the optimal output. For the teeth segmentation, the middle coordinates of each predicted bounding boxes will be identified. Also, the mid-coordinates of region of interest or ROI is determined. ROI is the region on image that contains the bounding boxes. Each bounding box coordinates are compared to ROI's coordinates to locate what quadrant they are located. Lastly, each quadrant will be sorted to gain the final tooth assignment.
The RPi-0 facilitates the process of the device, which is powered by 2 lithium-ion. When the camera button is pressed, it activates the camera as well as the LED indicator. The number is also updated on the 7 segment. Once the images are complete, it is sent to the laptop via SCP, or Secure Copy Protocol. The casing of the prototype was 3D modeled to accommodate the dimensions and shapes of the components, such as the 7 segment, camera, customized buttons, switches, and ports. The design was made compact and portable for convenience when held by the user or the dentist. The camera holder was made detachable for sterilization or for replacement. It has also micro USB port common for phone chargers.
The flowchart depicts the software development. Datasets were created by gathering images and labeling them based on their classification. These datasets will be divided into training and testing. Then, configuration files were created including the architecture for YOLO V3. For the training process, it will be stopped until such time that the average loss is less than 1 and the accuracy is greater than or equal to 80%. Lastly, the results for the testing will be recorded.
Here's the actual setup. The software on the laptop needs 3 images, the front, upper, and lower, on that particular order. The following figure shows the actual device and the manner it is used with the light source. It also shows a 5-second preview before the camera takes the shot. And if ever the image is undesirable, the user can just press delete.
For sample testing, 3 patients were tested shown in Table 1. Empty cells fall under the category of unknown. Unknown classification catches the tooth condition classification in normal dental charts that were not part of the study, or it may also be due to captured images not being able to clearly show the tooth. Based on the table, 88 out of 96 were correctly predicted. The video depicts the actual generation of the dental chart using the created application. The left image showed the actual prediction of the system to the sent images by the device. These predictions will be appended together with the images in an Excel format and will serve as the final output shown in the right image. Confusion matrix consists of actual and predicted tooth conditions. The teeth images tested from 10 patients resulted in 320 total datasets. The value with green cell represents the true positives. The value from the confusion matrix were also used to acquire the false positives, true negatives, and false negatives. These are required for calculating the specificity and sensitivity. The tooth condition classification model obtained an accuracy of 88.125%. Furthermore, the specificity for each classification got a score near 1, with 1 being the ideal value. Although the sensitivity for missing tooth is lower compared to the rest, most of them were near 1. To sum it up, accurate dental charting system was achieved having an accuracy of 88.125%. This is made possible by using both image processing techniques and convolutional neural network. The sensitivity and specificity are desirable, and the device was successfully created that captures different portions of teeth. For recommendations, to gain higher accuracy, gathering more images per classification and using new versions of YOLO are required. Also, adding other classifications that are not included in the study are welcomed. Flexibility and stability of the device is necessary to ensure ease of use and provide ideal images. Some suggestions are adding dental cheek retractor and improving light capability. This ends our video presentation. Thank you for watching.